Hello everyone, I'm Dr. Diron. So today, the one of the most important topic that I'm going to talk about is small intestinal bacterial overgrowth. We used to say SIBO. Most of the people who come to the clinic, what they complain about regarding the digestive system, flatulence and indigestions and abdominal pain. Those are the commonest problems they used to complain. But what we almost think about this complaint, we come to some conclusion or some ideas. It could be a gastric ulcer, it could be an inflammatory bowel disease. But are these only those problems? No, there is something called small intestinal bacterial overgrowth, or I hope that you might have heard about this. Look at the term small intestinal bacterial overgrowth. We have bacteria in our small intestine, in large intestine. But when we talk about this bacterial overgrowth, above limited amounts, the bacteria overgrowth and trouble us. How do we diagnose this? How patients will be presented? Of course, they will be presented with this abdominal pain, over gas production, flatulence, abdominal pain, indigestion problems. What are the causes? Could be this small intestinal bacterial overgrowth. There are plenty of causes. The commonest one are poor motility, poor movements of your intestinal tract. And it could be any chronic diseases such as diabetes and all. Some anatomical problem of your digestive tract such as diverticulosis and all. And also because of some surgical issues, maybe there may be adhesions. And also poor or low level of acid production that cannot kill the excessive growth of the bacteria. So the plenty of causes are there for that. And also our poor lifestyle. How are we going to diagnose this? There are plenty of ways to diagnose. The commonest way to diagnose is, one is the breath test, second one is aspiration of your intestinal content and growth of the bacteria. The breath tests are the easiest way to diagnose this small intestinal bacterial overgrowth. For example, there are hydrogen breath tests, there are 14 carbon silase breath test, there are 14 carbon glycocolate tests. These are the commonest tests. So what do we do in case of hydrogen test? We advise the patient to eat a sugar content food, and then we check the level of the hydrogen in the breath. So the bacteria will metabolize that. The second one is 14 carbon silase test. Again, we give the patients to the 14 carbon label silase, and the bacteria will metabolize that and it will release the 14 carbon dioxide gas, as well as that indicate the carbohydrate metabolism abnormalities. And the third one is 14 carbons glycocolate labeled diet we give them, and that also after utilized by the bacteria, we check the 14 carbon dioxide, as well as it indicates the bile metabolism abnormality. So these are the commonest non-invasive tests that we use to diagnose this small intestinal bacterial overgrowth. Plus, we take the aspiration of our intestinal content and we go for the growth. So we diagnose, and how do we treat this patient? Of course, we usually never start with medication. The first ultimate treatment is lifestyle modification, dietary modification, and then we go for the pharmacological treatment. And I hope that this video is really helpful for you, and we'll see you in next video. Thank you.